As the director of the Biomedical Center, I would like to introduce everyone to the biological principles behind the breast biorhythm monitoring system. Before delving into the medical principles of our system, I would first like to provide a brief overview of the epidemiological background of breast cancer. This is a report from the World Health Organization, based on epidemiological data from 2022. This report was published in 2024, which is this year. Based on this report, there are a few important points we can note. Firstly, breast cancer caused 670,000 deaths in 2022. Additionally, in about half of these cases, we do not know the exact cause or risk factors. This indicates that for roughly half of breast cancer patients, we do not even know the cause of the disease, making it difficult to prevent breast cancer proactively. Although the aforementioned epidemiological data appears quite pessimistic, another report from the CA Journal provides us with more encouraging information. Specifically, for early-stage breast cancer, namely stage 1 and stage 2, the 5-year survival rate can exceed 90%. From this chart, we can see the 5-year survival rate for breast cancer, from stage 1 to stage 4, showing a gradual decline as the cancer progresses from early to advanced stages. For stage 4 breast cancer, the survival rate drops to 20 to 30%. Of course, this data is based on medical statistics from the United States, and the 5-year survival rate might be lower in some developing countries. Let's look at another article from Natural Review which defines early breast cancer as cancer contained within the breast and only spread to the axillary lymph nodes. This corresponds to stages 1 and 2, and such early breast cancer is considered curable. Given this promising scenario, why does breast cancer still result in such high mortality rates? Upon further investigation of breast cancer diagnosis reports in China, the data is quite sobering. In China, when breast cancer is clinically diagnosed for the first time, 82% of cases are already at mid to late stages. In other words, the diagnosis rate for early breast cancer is less than 20% in mainland China. Despite the country's efforts to promote early screening for breast cancer, the actual situation remains challenging. The low prevalence of breast cancer screening and the influence of economic policies on screening frequency result in less than 5% of breast cancer cases being detected through screening. This means that 95% of cases are discovered only after symptoms appear and patients seek clinical diagnosis and treatment. To address the current insufficiency in early screening, our company has proposed the idea of developing a home-based breast cancer diagnostic or early warning system. This system can significantly help patients who have passed the early detection window, enabling more patients to discover cancer in its treatable stages. This is the mission of our company. Our system consists of 3 main components. The first is a sensor that can monitor changes in breast temperature and humidity in real time, extracting pathological characteristics or information related to breast cancer. This information is transmitted to a cloud server, where we have deployed an advanced AI algorithm that has been trained. Dr. Wang Yang will demonstrate this to everyone. Finally, the server analyzes the data to determine a risk level and communicates this risk level to the user via Bluetooth or a mobile app, providing suggestions on whether further clinical diagnosis or treatment is necessary.